Hey guys, so I'll be going over the medical terminology for your body. Your cephalic is also known as your head. Your frontal is your forehead. Your nasal is your nose. The orbital is your eye. The buccal is your cheek. The brachial is your arm. The sural is your calf. The antebrachial is your front elbow. Your palmar is also known as your palm. And your carpal is your wrist. Your popliteal is your posterior knee, and the olecranial is your back elbow. The antecubital is your forearm. Your pollex is your thumb, and digitals are referred to either as your toes or your fingers. Your patellar is your anterior knee, and your leg is referred to as your crural. Your tarsal is your ankle, and the hallux is your big toe. The occipital is the base of the skull, and the dorsum is your back. Your spine is also known as your vertebral, and the scapular is your shoulder blade. And the sacral is the part of your body in between your hips. Lumbar is also known as your loin, and femoral is also known as your thigh. The calcaneal is your heel, and finally the plantar is the sole of your foot. Posterior refers to something on the front side, and anterior focuses on something on the back side. Superior refers to something that is above a certain body part, and inferior refers to something that is below any body part. A medial is any midline, and a lateral is anything that is away from the midline. Now, the intermediate is any space in between the lateral and the midline. A proximal is a point of origin, so where the arrow begins, and a distal is anything away from the origin, so where the arrow ends. A superficial wound is something that is external or just on the surface, and a deep wound is something that is internal or beneath the surface. A mid-sagittal cut is something that is a vertical cut, and a transverse cut is a cut that is horizontal. And an oblique cut is a diagonal cut.